लिंक अच्छा ठीक है are watching but
वाईफाई से कर रहे हैं क्या?
नहीं
एक बार रिफ्रेश करके देखिए। आया ठीक है
ये आ जाना हो गया
मेरे स्टूडेंट्स को पूछना पहला स्लाइड good noon to all. I hope you can see the live streaming now. Okay, then let us start. I got a reply from some of the students saying that it is going live. I hope everybody is doing well. And today I am going to talk about personality disorders. As you all of you know about some of the personality types, and when we get certain deviation from those personality types or in our personality, it will end up in personality disorders. So let us see. So the objective of this class, at the end of the class, you would be able to define what is personality disorders, and you would be able to classify personality disorders, and you will be able to enlist or describe the causes of personality disorders and explain the treatment. And as a nursing student and the becoming nursing officer, how we can deal with the personality disorders patients. That is the main objective of this today's class. So at the outset, I would like to differentiate between personality and the human behavior. So the slides clearly depicts that personality is what we are, but the behavior is what? The behavior is what we do. And you all of you know that the personalities we cannot change. Like what we are, it is very difficult to change, but some of our behavior we can change. And the personalities seem to be like a stable, consistent pattern of thought, behaviors and emotions. In a sense, we can say that in our behavior is some sort of our behavior is really an expression of the personality itself. But we can change our behavior, but we cannot change our personality. So coming to the personality disorders, what is a personality disorders? It says that it's a way of thinking when there is a disturbances in our way of thinking, feeling, behaving that deviates from the expectation of the culture, and that will definitely going to cause the distress and problems in the day-to-day functioning, and that need to be last over a time. In some of the article it has been written that it must last for at least for an year in order to diagnose as a personality disorder. So that is what they are saying. It is not like 15 days or a month. They are saying that it must be lasting for an year to diagnose. But where and all we can expect the disturbances, the thinking, feeling, behaving that deviates from the normal expectation, and that must cause a distress. How prevalent this? This is prevalent between 10 and 20% in the general population, and its duration is expressed in decades. That's what it's going to for a long run. It is not like that the course of these personality disorders that is only for a month or maybe for an year, but no, it will last for many decades. That is the one thing you have to remember. This means that at least 1 in every 5 to 10 individuals in the community has the personality disorders. Okay, so the classification of personality disorders. Also, I think all of you know that there are 2 main classification in psychiatry, that is the ICD-10 classification by WHO and DSM classification by American Psychiatric Association. So in ICD-10 it is coming under the F category. In the code is 60 is the code given for ICD-10. But as per the DSM, how it is classified? It is classified as cluster A, cluster B and cluster C. So I will say to you that this is the most important slide for today's class. Like, if you remember what are the clusters, and in each clusters there are total of 10 disorders which is coming, right? So cluster A consists of paranoid, schizoid and schizotypal, and cluster B consists of antisocial, narcissistic, histrionic, borderline, and whereas cluster C is for what? Avoidant, dependent and obsessive compulsive. So altogether, how many disorders are there? There are around 10. There are 10 disorders, 10 personality disorders are there that have been clubbed into 3 clusters: cluster A, cluster B and cluster C. So the main typical characteristic of cluster A are they are weird. Okay, they are considered, they show many weird behavior. And coming to the cluster B, how they are little bit wild people, like they are aggressive, they are antisocial, okay, they are borderline, they are cluster B. And whereas cluster C are what? They are worried people. So we can say that cluster A are weird, cluster B are wild, and cluster C are those people, those category which got more of worrying symptoms. A total of 10 disorders. It is again, I am going back to the slide, that is again classified as cluster A, cluster B and cluster C. So in the beginning you have to understand, according to DSM-4, the personality disorders are categorized in these 3 clusters. So we will go one by one in detail to know how to have a better understanding. I said cluster A people are weird people, right? What all are they are coming? They are paranoid, they are schizoid personality disorders and the schizotypal personality disorders. So the paranoid personality disorder, how they are? They always try to accuse others, right? They believe that they are perfect, they are right in everything, but others, there is something wrong with the others. That is a paranoid personality disorders. Okay, or we can say that they suspect others or they accuse others. Whereas schizoid personality disorders, they always live in a solitary mode, right? So they are aloof. And whereas schizotypal, they always show some awkward behaviors, like they may be thinking about some magical thinking, or they may be saying about some sixth sense. Those are awkward behavior they will show. Let us see what all are the one. First one is paranoid. I hope everybody know the word paranoid, right? So here, because of that paranoid word, what is the most important thing to remember? That is what? Having a long-standing pattern of pervasive distrust and the suspiciousness of others, right? So the typical features is that they will not be able to trust anyone, and they will have the suspiciousness of the others. As then how they will not tolerate any insult, even a slight arguments or a rebuff, right? They don't have the ability, we can say that they are very hypersensitivity to this insult or rebuff or slights. That is a second characteristic, right? Unwarranted tendency to question the loyalty of friends or maybe the fidelity of spouse or a sex partners. They will always try to question that how loyal you are. That means they have the doubt, that suspiciousness, right? So because of their suspiciousness, then these people try to and have the tendency to question the loyalty of the partners or a friends. No doubt, because of these all features, they will be reluctant to confide into the others, because they may be thinking that if we share, those people share the information, then they will be using that information in against, plotting against them. So that they have reluctant to confide to. So let us take an example. Here there are 32-year-old male complaining of his girlfriend being untrustworthy, feels she is taking advantage of him, and does not like her talking to friends on the phone, and feels people at work don't like him, lashed out at a stranger who was laughing loudly during a funny movie. That means, you see, these are some of the typical characteristics: being untrustworthy, and they feel that the others are taking advantages of, the girlfriend is taking advantages of him, and he is suspicious. That means then he is not even happy at the work. They maybe they don't want to, he won't want to share the information to the co-workers and all. That may be the reason for showing these type of behaviors. So others are, this cat is saying that that's what this typical explanation, that the others are untrustworthy and they are trying to take advantages of me. So what do you understood? I hope you can understand that, you can remember the paranoid, suspiciousness, and not able to trust others are the typical features of these paranoid personality disorders. Coming to the next category, that is what? Schizoid personality disorders. I said schizoid personality disorders, they are awkward, or they are awkward, right? They show some the weird behaviors, such as they have the social detachment, and they are, and a restricted range of expression, expressed emotions in interpersonal settings, beginning by early adulthood and present in a variety of contexts, as indicated by, if you need to diagnose this, 4 or more of the following should be there. So what can be the 4 of the following? It can be, they would not show any, they will be indifference to praise and the criticism. If you praise them or if you criticize them, there won't be, they will not show any reaction. They will show that bluntness, and they will try to prefer the solitary activities. Okay, so schizoid, paranoid people are how? They are suspicious and untrustworthy, right? They don't trust others. Here what schizoid people are? Schizoid people are socially isolated, we can say, right? So they try to engage in their social solitary activities. They like to do their work alone, and maybe in their own fantasy world. So we can call them as a loners. They are a loners. They like to do it everything alone. Okay, no, they don't enjoy the company of others, right? So lack of interest in sexual interaction, lack of desire or pleasure in close relationship, emotionally cold, and detachment and flattened affectivity. And even we can say that they won't be having any close friends other than the family members. So if the people, if any of the 4 or more these symptoms are there, then we can conclude that the person is maybe having the schizoid personality disorders. The next one is the schizotypal personality disorders. I said that schizotypal personality disorders to show are those people will have some magical thinking, right? Or certain odd belief, like they believe in superstition, they believe in telepathy, or they may believe in sixth sense. These type of people, and they may be having an ideas of reference, but that is not at all the delusion. Okay, so they will feel that something is there. Okay, that is not for a persistent, for a long period, and they may have that some person may be standing near to him. Unusual perceptual disturbances may be there, like illusion, including bodily illusion or a sense of presence of person nearby. They may be having, so they may be even having a paranoid ideation, suspiciousness, lack of close friends. Okay, and though they have a strong desire to make the close friends, but still they won't be able to success in that. They have the odd thinking, speaking without coherence, means inappropriate and constrained affect they can. So here the people will is mainly they have some odd belief and magical thinking. If they are showing, then we can mainly say that that is a schizotypal. So we have discussed the first cluster. First cluster, what is the first cluster is saying? That they are saying that they are the weird people. Weird people in this form of paranoid, schizoid, and schizotypal. Paranoid, as all of you know, that they will try to accuse others, they will not trust, and they will doubt others. If some people are, or if there are people who like to be aloof or who like to be loners, then we can call it as a schizoid. And schizotypal will be mainly with the magical thinking and showing some odd behavior, maybe in the form of an illusion. Okay, that can be the one. Moving to the next cluster, that is called cluster B. So there are 4 disorders under the cluster B. So the cluster B, altogether we can say that they are aggressive. How they are aggressive? There are 4 disorders, like antisocial personality disorders, borderline personality disorders, histrionic personality disorders, and narcissistic personality disorders. So let us again go one by one in detail. That is the first one. It is antisocial personality disorder. I hope the word itself, it is saying that antisocial. They are not following the norms and the rules which is set by the society. They don't follow it. So when they are not able to follow the rules, and then they go against the societal norms, majority of the time that will end up in an antisocial activity, right? So the hallmark features of antisocial personality disorders are pervasive disregard and violation of rights of others, occurring since 15 years of age. That means they might have some history of a conduct disorders in the before, and that may be the continuing in the future, and that can lead into maybe this type of antisocial personality disorder. So what are the diagnostic criteria? There must be at least 3 of the following. What all could be? Failure to conform to the social norms. Okay, they won't adhere to these rules and regulation which is set by the society, and that will end up in engaging in many, maybe end up in resulting in a frequent arrest. They will be deceitful. That means what? Including lying, conning others for the personal profit, and then will deceitful, the word meaning, it's like they are untrustworthy, right? So we cannot believe them. They will lie and they will use others for their profit and the pleasure. No doubt they are impulsive. Impulsive in the sense means they won't think and react. Okay, they won't even they won't be able to plan in future in an advance, in a better way. They are irritable and they are aggressive. That means because of their irritability and aggressiveness, they may also engage in very frequent fights or assault. Definitely they are going to do some reckless behavior. Okay, in terms of the safety of self and the others, they won't consider that the safety of self and others. They are irresponsible. That means whatever the obligation or the responsibilities which is being he need to do, that she or she need to do, that he won't be able to perform it. So among these all the few points, if there are 3 points, if he fulfill, then we can call it as the person with antisocial personality disorders. Coming to the next category, the second, there are total 4 personality disorder in this. The second one, narcissistic personality disorders. The clinical criteria, at least 5 of the following. Okay, so what are the narcissistic personality disorders? They are saying the grandiose sense of self-importance and special. So narcissistic, you can simply remember, they feel that they are something special. Like they are someone special who came into this world with some particular purpose, maybe with some certain privileges. They try to behave in that way. That is the grandiose feeling they have. That means I am the supreme, I am the most perfect one, and I have got all the things what I want. And so they will behave in that form of way. That is a grandiose sense of giving more importance to self, and they will feel that they are something special. Because of that, they will be always in a preoccupied world with fantasies of unlimited success, power, and maybe the beauty, or maybe they're brilliant. They will show many things to show that they are something special, and they got some certain sense of entitlement or certain sense of privileges. Interpersonal exploitation, such as taking advantages of the others to achieve own needs. Okay, that means they will use others in order to get advantages for himself or herself. They will lack empathy, and they will try to have an excessive need for admiration and acclaim. That means they feel that they want some special consideration from the others because they are special. They are some high-fi people. Okay, or we can simply say that they always expect a VIP treatment. Right. So intensive and chronic envy. they will be jealous, or they will have a very intense and chronic envy towards others, and they will show very arrogant and very haughty attitude. They won't respect others, and they will show this arrogant and haughty attitude to the others. So if we have at least 5 of the following, then we can say that the person is having the narcissistic personality. So first one was antisocial in the cluster B, second one is the narcissistic personality, and the third one is what? The histrionic personality. We can say that these are type of drama people. So they do many dramas in order to get attention, right? So histrionic, the word itself, I hope you can understand from that. They will do many dramas, like how and all. The disorders are pervasive and excessive self-dramatization, excessive emotionality, and attention seeking. At least 5 of the following should be there in order to diagnose. What is that? They will try to seduct, or they will try to provocate others to maybe sometime to engage in the sexual activities, that is inappropriate sexual seductiveness, we can say. The second point is that excessive need to be in the center of attention, and that means every time when how many people are there, they won't think that he or she the one need more attention. They will shift their mood, or they will shift their emotions very frequently, and they are suggestibility. That means they will easily get influenced by the suggestion of others without even thinking, or without even logically connecting what is whether it is right or not. They will easily accept their other suggestion. That is, they are suggestible. Physical appearance, sometimes they may use to get advantages, or for the attention of seeking they will use their physical attention. Sometimes they will try to impress others, but sometimes they may be lacking in the detail that how they want to impress, or in the speech sometimes they will not be that perfect in that. Self-dramatization and exaggerated expression of the emotions can be there, and relationship they were considered to be more intimate than the usual. Really actually how we want, really in how they want, they will think that it's not that, they will feel the relationship in a more intimate way. So by seeing the relationship in a more intimate way, maybe the partners won't understand what they are trying to what they are expecting. So that may also end up in a various relationship problem. So in a nutshell, what we can say that histrionic personality are what type of people? They are dramatic people. Okay, why they are doing dramas, more self-dramatization, in order to get maybe in order to show their emotions, or maybe to get attention from the others. That is the histrionic personality. And the next one is what? The borderline personality disorders. How the borderline personality disorders? It is the word itself, it is saying that they are in the borderline. They don't know where they are actually in terms of anything, right? So it is include diagnostic features include at least 5 of the following, right? Frantic efforts to avoid real or imagined abandonment, and they are unstable. In a simple terms, we can say that they are unstable in everything, in terms of relationship, or in terms of their actions, and in terms of their behavior. They are highly unstable. So what they will do many effort in order to feel, or in order to, maybe they may be feeling isolation, or they may be feeling abandonment, but in order to avoid that, they will show all the efforts. That abandonment can be a real, or sometimes it can be an imagined one. Markedly and persistently unstable self-image, or a sense of self-worth. Okay, so they will feel that the self-image or self they are not stable. They will show the instability in that too. No doubt they are also impulsive. Impulsivity will show in at least in some of the followings, like they will be in spending, sex, substance abuse, maybe a binge eating, maybe a reckless driving. So if they will be showing impulsivity, that means without thinking they will spend, without thinking they may engage in various substance abusing activities. Okay, or maybe they may engage in reckless driving. Okay, and the other points, that is what they will be showing a recurrent suicidal threat. So suicidal threat or gestures, they may be showing different self-mutilating behaviors. They may be showing. There may be instability of affect due to marked reactivity of the mood, chronic feeling of emptiness. That's what I said in the first point. That is what they will feel, that they are abandoned. Okay, they are alone, they are abandoned. They will try their level best to make it compensate that emptiness. Inappropriately intense anger or difficulty in controlling the anger they may show. Stress related transient paranoid ideation, or maybe sometimes they may show the dissociative symptoms like amnesia, or that can be sometimes they will show the stress related symptoms also for a transient, for a short period. So if any 5 of these things are there, then we can say that the person is having the borderline personality disorder. So what they are unstable. Okay, so they are not stable, and they will show the impulsivity, and they are not stable about self-image, their self-worth, everything. They are not stable in that. Because of that instability, they may be feeling very low sometime, and they may be also having then anger problem and all. Okay, these all are the things. So the cluster B is mainly what? They are aggressive people. They consist of antisocial personality disorders, borderline personality disorder, histrionic and narcissistic personality disorder. And the last cluster, that is what? Cluster C. Cluster C are worried people, right? How are they worried? They are worried of being avoiding. Sometimes they are worried about their perfection, that is obsessive compulsive, and sometimes they are worried about, I am not able to take a decision, I need somebody's help. So that can be the dependent personality disorders. So there are 3 main disorders, like avoidant, obsessive compulsive and dependent personality disorders. Let us see avoidant, how they are. Okay, so in this picture you can appreciate that they are shy, they are timid, they are socially inhibited, they have low self-esteem, and they will feel that I am so incapable, I am so inadequate, and I think they feel very hopeless, and they don't accept what they are. They feel very low self-esteem. Though they want to have a close relationship, but they won't able to take any initiative for it. They really take social risk and avoid social situation. They hardly meet the people, and why? Because they are hypersensitivity for the rejection and the negative feedback. So what they will think in their mind, if I try to meet the others, if I try to talk to the others, how they will feel, how they will react, will they reject me or will they criticize me? Those feelings or those thinking will make them to avoid. So the diagnostic criteria is at least 4 of the following. As the word itself, avoidance of occupational activity that includes significant interpersonal involvement, right? The person may not be able to work in a group. That is the main thing. And the second one, unwillingness to be involved with the others unless certain of being liked. They will be having the unwillingness to be involved with the others. Though they may be working with their close associate, but majority of the time they won't be having the unwillingness to work with a stranger, or we can say that they won't engage as the normal. Restraint in intimate relationship because of the fear of being shamed or ridiculed. Why they are withdrawing from to self? Because they feel they have that fear of being shamed in front of others, or fear of getting criticized in front of others. That is the reason they are being restrained. Avoidance, unwillingness and restraint. No doubt they will be always having a thought, or they will be preoccupied with the criticism, and they will be preoccupied with the rejecting in the social situation. Inhibition in new social situation because of feeling of inadequacy. Okay, they will withdraw from all the social gatherings or situations. Reluctant to take personal risk and to engage in any new activities because they may be more embarrassing for them. They won't accept any new responsibilities or new work, and they view self as a socially incomplete, or they will feel that that means what? They will feel they are socially useless. In a simple terms, we can say that personality is unappealing and they are inferior to others. That type of low self-esteem characteristic they will try to show. So if at least 4 of the following is there, then we can say that the person is having avoidant personality disorders. The next one is what? Dependent. Dependent means what? They are always depending upon any others for their day-to-day activities, for their even a simple decision. They, like for example, if they want to what to eat, they are not able to take a decision what to eat. They will ask their friends or someone who is close then them for their daily actions. Like they want somebody to hold on in order to continue the living. So what are the 5 following things you must remember? Difficulty in making everyday decisions without the advice from the others, and need for others to assume responsibility for the major areas in her life. They need for others to assume the responsibility for major areas. That means they are not able to take the decision. And the difficulty in expressing disagreement with the others because of fear or loss of support and or the approval. And the lack of initiative, they won't also do some, they won't even start a new activity, or they won't even start alone. They feel that somebody is there to help for all the decisions. They will also be having a preoccupation with the fear of being left alone, because he or she don't know how to take care of self. Urgent search of another relationship. For instance, if one relationship came to an end, then they will try for some other person urge very quickly, so that she needs somebody help to go ahead in the life. Extensive effort to obtain the assurance and support from the others. They will do all the frantic efforts to get help from the others. Uncomfortable and helpless feeling when they are left alone. Right? For instance, if they are being alone, then they will feel like how I will live, how I will survive. Those type of helpless feeling they may have, because they need somebody there to help. And the last personality disorder, that is in the C category, that is what? Obsessive compulsive personality disorders. I hope you may be familiar with the obsessive compulsive disorders, which we had already a class. So diagnostic features also include at least 4 of the following: preoccupation with the details, rules, list, order, procedures, or they will be highly preoccupied with this order, rules, and this but how they will be mainly focusing on that. They need perfect, everything should be in a perfect order. The task need to be complete in a perfect way. So excessive devotion to work and productivity, and they won't even engage in any leisure activities, or they won't have any social connects, and they will be highly focusing on the work and the productivity. And that is the main thing we can say. They are focusing, they need everything in a perfect way, right? So they are over conscious, and they are inflexible about the matters in terms of morality, ethics, and the values. They are highly conscious, and they are very rigid. They won't go beyond their morality, ethics, and the values. They will never ever go. They will inability to discard some of the worn-out or worthless object. They may be thinking that it can be used in the later. Some use will come in the future, and they will be even reluctant to delegate the task. Okay, because they may be feeling that others won't be able to do in a perfect way, or not in a good way. So by thinking that, they will be having the reluctance to delegate the task. They will be, we can say that they will show some stinginess behavior by thinking that the money maybe if you used otherwise, how I will survive in the future if there is any natural calamities or any urgency. So they will be very stingy in terms of spending the money also. Rigidity and stubbornness are the other 5 other features we can observe them. So this is at least 4 of these things are there. Then we can say obsessive compulsive personality disorder. So now it is natural to get a doubt that what is the difference between obsessive personality disorders and obsessive compulsive disorder. So what is it? Obsessive compulsive disorders, as I discussed you in the class already, saying that it is an anxiety disorders. What will happen? There is a cycle, right? So obsession, anxiety, compulsion, and then after a few minutes or a few then again there is an obsession. So that cycle is continuing, right? Okay, so in order to reduce the anxiety, they may be engaging in a very compulsive behavior, right? So in that, the person will have this strong desire to cut down this compulsive activity, or to have a strong desire to cut down the obsessive thought. But here, what is there in obsessive compulsive personality disorder? these people are happy with what they are, right? They feel that they are okay, they are perfect, they don't have any problem, means they feel that they don't want to change, they are happy with what they are, though they are doing these symptoms, these actions, but still they believe that they are okay and it won't affect their means they will feel it is perfect, like they feel that it is okay to be live like in a this doing the things again and again and all. But what is the difference? In obsessive compulsive disorders, we can say that they will have the wishes to, they will try to stop as much as possible, they will do the effort, that is why it is called ego dystonic. Whereas obsessive compulsive personality disorders, what they are saying, they are ego syntonic. That means ego is not at all having any problem, ego is saying that this is okay, you can go ahead with this. So that is the basic difference between obsessive compulsive personality disorders and obsessive compulsive disorders. So these all are the three main categories, right? So these three main categories you must remember: cluster A, cluster B, and cluster C. If you look into what can be the causes of personality disorders, we can say that it is a combination of genetic and environmental influences. So it is, we cannot pinpoint a single cause that is the exact reason for the personality disorders, because as I said that it will take long years to develop and it will go for a many decades too. The causes can be genetic and environmental influences. The childhood trauma, verbal abuse, and hyperreactivity in the childhood, that can be some of the predisposing factors for these personality disorders. How we can treat? We can treat also as the disorders, we say that it is having a multiple symptoms and multiple predisposing factors. We also need to use a combination of medication and psychotherapies. So we can say that it is better to use a combination of medication and psychotherapy than just focusing on medicines. So the drugs which we can commonly use, that is what maybe we can go for with an antipsychotic medications, and some of the drugs like lithium, mood stabilizers, benzodiazepines, and some antidepressants like SSRIs, MOIs can be used to treat the personality disorders, depending upon what the patient's symptoms they are having. Based on that we can use individual and the group psychotherapy. So this is very important, as I said that we need to have a combination of treatment, if like psychotherapy along with the drugs. Okay, so what can be the individual and group psychotherapy? We can focus on building trust, teaching basic living skill, providing support and decreasing the distressing symptom, teaching them relaxation or meditation techniques and assertiveness training. And those all things we can mainly focus on individual as well as in the group psychotherapy. And one special psychotherapy which you need to remember, dialectical behavior therapy, which is particularly designed for a borderline personality disorders. So what they are teaching them, it is mainly focusing on thinking and behavior based on the assumption that poorly regulated emotions are causing the problem. So when they are not able to control their emotions, that is the reason for the development of all these symptoms. So how they can control? They can control by learning these techniques or making them to do this technique, right? So the psychotherapist will make them to do mindfulness. What is that? It is the practice of being fully aware and present in this one moment. And they will try to make them to understand how to tolerate the distress, how to tolerate the pain, or how to tolerate and go ahead and accept it. Then they will try to make them about the interpersonal effectiveness, how to ask for and what you want and say no while maintaining the self-respect and relationship with the others. And then they will make us to learn emotion regulation. That means how to change their emotion and whenever they want and how to adjust with that. So these all are the 4 techniques they will teach: mindfulness, distress tolerance, interpersonal effectiveness, and emotion regulation. So coming to the nursing management, as we all of you know that first we start with assessment, history collection, mental status examination, and we will identify what are the problems prevailing. Based on that we can treat. Okay, so based on the thing priority we can treat. So no doubt the utmost priority is the safety of the individual, right? Safety of the patient as well as the others. Okay, so maintaining the safe environment is the prime importance. So precaution should be taken to reduce the risk of harm to self or others. Remove all the precautions as a nursing officers, or we have to take all the precautions for it. Remove all the items that may be used as a weapon or that may harm self or others. Frequent observation is very essential, as we all of you know that. So in order to ensure the safety, awareness of the safety for healthcare professionals is also need to be kept in high priority. That means we must share that these people are having these issues. That means please, so that others also will have a look at that patient. Avoid wearing jewelry such as necklace, and avoid wearing long hairs in a ponytail. That as a nursing officer or a nursing student we can avoid when we deal with personality disorders patient. The next intervention, mainly we can make a pact, or we can make a contract. We can make a written contract that these are the expected behaviors what we are expecting from you, and this is also in addition point you can make them note that patient will not harm self or the others during this particular time period. And so whenever they adhere to these contract, we can positively reinforce them, and we need to make them understand these are the expected behaviors, and if you are not following this, not showing this, these all are the after effect of that. Okay, these all things you will get. Like the next one is establish a therapeutic rapport with the patient. We all of you know that it is one of the main essential things for any nursing intervention. We have to build a good rapport and a therapeutic relationship with our patient. So as we usually do trust and rapport building in the initial period, then they will go into the working phase like straightforward communication and avoiding it. We have to be very straightforward in our communications. Try to avoid the use of medical jargon. Be empathetic, and try to be non-judgmental. That is also very vital. Coming to some of the other nursing interventions, let the patient know what behavior are acceptable, and we have to set the limit for it. The patient know that what we are expecting, and that we have to make them understand. We can even make them understand what are the anxiety reduction strategies that we can make them understand. Encourage the discussion of feelings. Allow them to freely ventilate and encourage the discussion. And no doubt one of the other prime responsibility, that is what? Patient and family teaching. That is also the primary responsibility. So these all are some other interventions. So to sum up today's class, what I want to say that what I said, these are the three categories, that is paranoid, schizoid and schizotypal. Those people are weird people, and there are certain aggressive people category, that is cluster B, antisocial, narcissistic, histrionic and borderline. And cluster C, avoidant, dependent and obsessive compulsive. So altogether I hope you got some idea. And the three causes are not a single cause. The causes can be also multiple, genetic as well as environmental. Treatment are also the combination of drugs as well as the psychotherapies. Dialectical psychotherapy or cognitive behavior therapy is specially designed for the borderline personality disorders. And finally, coming to nursing management, that is starting with the nursing assessment, then we can do the interventions like maintaining the safety, developing a contract, anxiety reduction strategies we can teach them, we can explain them what we are expecting from them, and we can do the patient as well as the relative teaching. But altogether we can say that. Okay, to conclude, the development of personality disorders involve many factors, as I said before also, and it will take a long time. So the treatment also is a lengthy process, and it is required a constant and a very constant effort in order to do the proper and better recovery. Medication may be used to enhance the therapy, that we cannot say that will cure the complete disease. As I said, both the combination of medicine as well as psychotherapy is going to be more effective. So we have to identify, as a nursing student and a nursing officers, we have to identify the behavior associated with each personality disorders. Based on that, we have to plan and what behavior they are showing, and appropriate interventions we can plan in managing these patients. That's all about today's. I hope everybody got some understanding regarding personality disorders, what can be the causes, the treatment, the nursing management. So I request you, all of you, in the view of COVID-19 pandemic, so let's break the chain by practicing social distancing and being safe. I hope you all are safe in wherever you are, and please take care. If you have any doubt, please ask. You can ask me if you have any doubt. I will reply to you in message. I think it's supposed to be in message. Okay then. Okay, be safe everyone and take care. Thank you for joining. If you have any doubt, okay, if a child is, for example, somebody is asked you a doubt, okay, let me see that. If a child engaged in an antisocial work who is 18-year-old, how we differentiate whether it is a conduct disorders or it is an antisocial? Yeah, if who is an 18-year-old, we can say that it is going to be an antisocial personality disorders only. Conduct disorders which should be below to 18 years of age. That age is the limit, we can say. Any other any other thing, any other questions you have, you can ask. Anyway, thank you for the question. I hope I answered it. If you have more clarification in this, you can even mail or even WhatsApp me, that I will try to answer. Anyway, thank you so much. Thank you so much, my dear students, and please take care, all of you. It's done, right? We can close. This will take a screenshot of this, right?
Shit, I did not take it. देखो कहीं ना कहीं तो होगा ना. Excuse me.
Okay, bye-bye.
नहीं
इसका अटेंडेंस